Great. Chair Pani, introduce yourself to the committee, please. Okay,
Honorable Chair, my name is Dr. Kwabena Sapon. I'm the regional director, actually. The head of BMC will join us very soon.
I am Mahama Mawia, the internal auditor.
That's welcome. That your infraction has to do with some expired drugs to the tune of over 1 million Ghana cedis. And of particular interest on the list is the first line item. Beg my pronunciation. Lisinipro tablets. Lisinopro tablets. Lisinopral. And that is almost 720,000 Ghana cedis. Sir, you are welcome. Is he going to answer questions? Then he needs to be sworn in, sir. Or he's been sworn in? You've not been sworn in? Okay.
I, Dr. Mahmoud Aliu Salama,
swear by the Almighty God
swear by the Almighty God
that the evidence I shall give before this committee
that the evidence I shall give before this committee
touching the matter and issue
shall be the truth,
the whole truth,
and
nothing but the truth.
So
help me God.
So help me God.
Doc, welcome.
Thank you, Chair.
Yes, Doc. Doc, I was asking for what lisinopril is used for, tablets.
Okay. Thank you, Chair. Lisinopril is an antihypertensive. So it's used in the treatment of elevated blood pressure. Thank you.
Then it suggests to me that you have a lot of elevated hypertension in the region, because you have almost about 24,000 of this drug in stock, and about 30 of them, 24,000, which has expired, and that is costing almost 720,000 Ghana cedis. That is 24,000 per whatever, a carton or so. That is quite expensive to have a lot of that in the constituency. Yes. And item number 3 is also the same thing. And that is about, a carton costed us about 18,500. Why? Who does the stock management and the procurement and requisition for these?
Okay. Thank you, Chair. So, Honorable Chairman, the drugs in question were not procured. They were donated items during the COVID era. And we can recall that a lot of social interventions were put in place during the era. So obviously we couldn't exhaust it before they got expired. There were times that we had almost a partial lockdown and total lockdown. So the OPD attendance reduced drastically. So that in essence amounted to we not able to exhaust it before the expiration. Thank you.
Okay. But have you taken the measures as enumerated here by the auditors to dispose of these drugs?
Yes, please.
Have they all been disposed of?
Yes, please.
Okay. Auditors, can we confirm that these drugs have been disposed of such that it will not get to the mainstream prescription for people to have them consumed?
Honorable Chair, we can confirm that the distraction of the drugs was carried out on 28 July 2025.
Doc.
Yes,
if I was an NGO or a company donating drugs, and then I hear you say, oh, we did not buy it, it was donated. So, I don't think, even if it was donated, the person used some resources to purchase those drugs. You understand? But you said, oh, we did not buy it, it was donated. When you realized that it was going to get bad, you could have called the various regions. I have this stock, I have that stock. Do you need it? Do you need that? We all know that hypertension is one of the rising cases, non-communicable diseases in this country. So next time, whether it's under COVID or under restrictive situations, let's not watch for it to expire because, one, we did not buy it, it was donated to us. But let's make good use of it because I know there are 1,001 people who cannot even purchase these drugs. So moving forward, let's guard jealously whoever donates medication or any other medical item to us so that when they sit back and they watch how we're using it or the impact of it, they will be in a position to always support us with some of these things. Yeah.
Thank you, Honorable Chairman.
Okay, Chiripone, I guess that is all for you. Auditors, have they disposed of it in the right way? Oh, okay.
Yes, Honorable Chair.
Thank you. The next one is Mamprugu Health Directorate. Is Mamprugu Muaduri Health Director, is it here? Are they here?
Yes, Honorable Chair. Unfortunately, they step out to find some snack for themselves.
Okay, let's move on.
But the regional director is there, and then I'm also there to support him as the internal auditor.
Can you speak to unpresented payment vouchers?
Yes, please, Honorable.
You can?
Yes,
okay,
please.
Then Honorable Day. Paragraph 1398.
This infraction has to do with unpresented payment voucher in the amount of 14,801 Ghana cedis. There was comment that District Health Director should recover an amount of 14,801 Ghana cedis from the accountant and same be paid into the Auditor General's recoveries account at the Bank of Ghana, failing which the District Health Director should pay. Unrepresented payment voucher did not cover this payment. What is the status of this recovery?
Thank you, Honorable Chair. The recommendation has since been complied with, and the money has since been paid with evidence submitted to the auditors.
Auditors, can you confirm payment?
Honorable Chair, they presented documents to the tune of 10,735.36. And then the actual payment was 4,066.
Could you figures again?
So what they did was they presented the PVs to the tune of 10,735.34. And then they recovered an amount of 4,066. So it is not that they recovered the entire amount of 14,801. So part is for documents that were presented, and then we had cash that was paid.
Okay.
So the question is, at the time of audit, where were these documents?
Thank you, Honorable Chair. An incident or accident happened at the time of the audit. Unfortunately, there was a change of leadership. The then district director, who was in charge, took the PVs to make payment at the northern region from the northeast. If you know where Mampuru Mauduri is, it's a very far place. So after making the payment, I think he was on his way back and had an accident. So but he was not able to, I don't know, he was not in himself at all. So finally, when the incident happened, we retrieved 3 of the PVs. And the 3 that we retrieved sum up to the 10,000 that my auditor is talking about. Those that we have seen were the one that was the 10,000. Those that we didn't see was the 4,000. So initially, we made a payment. The evidence are here. We made a payment 4,066 Ghana cedis. So when we submitted, it was rejected. That the recommendation is that the money be recovered, not the PVs be found. So my regional director has to press that they comply with the audit directive. Then we made a payment, 10,000 was paid. Unfortunately, the then director who made the payment didn't equally consult very well. He didn't look at the report and made a payment, leaving 735.34 Ghana cedis.
So
this
the
payment
bottom
has
line
since
is
been paid.
it's been taken care of.
So this payment has been paid. Now everything is cleared. And the evidences are here.
So there are a lot of people behind you. There are lots of people behind you. All right. The next infraction is on paragraph 1401. And Honorable Cletus will take care of that one. 1401.
Thank you, Chairman. 1401 has to do with health insurance. Claims rejected. Can you speak to this?
Thank you, Honorable Chair. The NHIS rejected claims is something that we are having very little control about. At times, it happens because of lack of the caliber of staff that we have to process that. But the recommendation the auditors ask is we need to seek clarification from the NHIS unit. And where we sit at the district level, we can only write the letter, route it through our regional director to Director General, and then to the NHIS. In fact, the evidence is also here. We have written, but yet to get any response to that effect.
Well, Chairman, the auditors, what I can say to this issue is that, some of the, for instance, if a pregnant woman goes to hospital, say, in a month, the scheme says that maybe you can attend to her twice. But if the person goes to hospital more than twice, then health insurance would deem it as like the person is abusing the system. But maybe medically, the person condition warranted that she should attend, hospital more than necessary in a month. So this is how these things came about. And sometimes they will also say overprescription and all of that. So we need to, I don't know how the auditors look at these things. So let's try to do some reconciliation there. Because if somebody is sick, the doctors can say that don't come to hospital. And when the person goes to hospital and present health insurance card, they must take it. So that is how these things comes about.
Yeah, honorable member. Yeah. Look at the management response at 1404.
Yes. Yeah, that's what I'm saying. The claims, I understand what you are saying, but you see, some of these things too, it's not their fault too. It's not their, that's what I mean. They are asking that the money should be, collected back. Where are they going to collect the money from? That's the point that I'm also making. Looking at the circumstances under which these things happen, it's so difficult to collect the money back.
Honorable member, you see, what management responded to was, management responded that a vetting committee will be put in place to support the preparation of claims through the IT system to drastically reduce the rate of disputed claims at the facilities. Did you do that? I've asked him the question. Okay. Did you do that?
Yes, there is a vetting committee in place.
And did you prepare the claims through the IT system?
Yeah, it's actually what we do. Unfortunately, like the honorable...
Sir, I'm not asking about what you normally do. You gave a response to the auditors.
Yeah, we did.
And I want to make sure that you follow through what you told the auditors.
We did.
And what came out of it?
We submit the claims through the LIM system, which is the light wave system. Yes, claim it.
Auditors, what have you observed lately?
Honorable Chair, subsequent audit will reveal whether indeed there is a committee in place and that an action has been taken on this matter. We are yet to carry out our next audit.
All right, thank you very much. Yours is Mampurugu. You are discharged.
Chairman, please, before they leave, Director General, or Regional Director, of Savannah. Moving forward, Regional Director of Northeast, yes. This drug issue that came about, the expiry date was 2023. COVID wasn't around in 2023. So please, and those who are here and are coming to sit here, that lie will not fly again. Because 2023, we didn't have strict COVID restrictions. Yet we had drugs that are needed by people that went bad because we refused or we sat on them and did not give it to the right people. So respectfully, Regional Director, let it not happen again. And the other regional directors, please, even if it means giving it to them for free rather than allowing it to go bad, let's do it that way. Rather than allow drugs to the tune of almost 800,000 Ghana cedis to go bad and come and sit here and tell us it was because of COVID restrictions in 2023. Please. Thank you.
Thank you very much.
You are discharged. Now, Northern Region, Regional Medical Stores, Tamale. Director General, I think if I'm not mistaken, Tamale is far from Accra. And if they came all the way from Tamale, they should be close by. So that when we call them, we can try and then discharge them early. Have you guys taken the oath, please? All of you, okay. Introduce yourself to the committee, please.
Honorable, my name is Chrysanthus Kubio, Regional Director of Health Service, Northern Region.
Mr. Chairman, good afternoon. My name is Mohamed Yakubu, Deputy Director of Administration, Northern Region. Mr. Chairman, my name is Dr. Inusa Adams, Medical Superintendent, Gushegu Municipal Hospital.
Mr. Chairman, my name is Abdullah Mohamed Awal, the Hospital Administrator, Gushegu Municipal Hospital.
Yes. I think the first paragraph, paragraph 1405, it says outstanding debtors balance of 36.2 million. But this includes that of the Northeast region, the Northern region, the Savannah region as well. So Savannah, there's a balance of 7.46 million that you ought to collect. The Northern region, there's 18.6 million Ghana cedis that you ought to collect. And then the Northeast, 10.12 million Ghana cedis. And so we have, is it the Northern region we have sitting here with us?
Yes, Honorable.
Okay, so yours is 18.2 million. Tell us how you have been able to collect those debts from the various places that you supply drugs to.
Thank you, Honorable. We have been able to collect a total of 23 million.
Out of the 36 million, you have collected 23?
Yes, Honorable.
Good. Okay. So break it down for us.
Leaving a total of 30 million, about 30 million.
The total is 36. So if you've collected 23, it can be, the difference can be 18 million.
13. 13.
Oh, you've collected 23,
yes.
And we are left with 13 million. Oh, okay.
Yeah, Honorable.
Thank you. So can you break it down for us?
So
how much goes to Northeast, Northern region, and the Savannah?
So for Northern region, we have collected a total of 15 million. Then the Savannah, 4.3 million. Northeast, 2.8 million, giving us a total of the 23 million.
So please, have you furnished the auditors with these payments?
Yes, please.
Auditors, can you please confirm?
Honorable Chair, we are here to have the status on this issue.
Oh.
Respectfully, you knew you were going to come here.
Honorable,
you were supposed to have been here in August. Gentlemen, we don't do that here. You can't tender through that. You give it to the clerk, and the clerk will hand it over.
Honorable, I'm very sorry about that. Thank you.
Respectfully, next time, you have to give it to them for them to validate before we can discharge or we can take what you are saying. Currently, as we speak, we cannot sit here and say that you have indeed paid 23 million. So you go back, reconcile with them for them to confirm, and then we can take that. But moving forward, what are the steps that you are taking so that you don't pile up so much?
So
in terms of supplying medicines to the various places.
We have engaged the BMC heads, and we have also mobilized debt collections, and we have ensured that anytime National Health Insurance pays, we ensure that we do the collections to reduce the indebtedness from the BMCs. We have also added it as part of their performance appraisals to ensure that the collections are done. Thank you.
And so when are you looking to deliver on the 13 million, the outstanding 13 million?
As at 24th of this month, we have been able to gather another 1 billion. And I don't remember the figures from Northeast and Savannah, but they have also done some collections. We are doing it together. Thank you.
Yes, so when are you going to finish collecting the 13 million?
By the close of the year.
By close of the year. And so we have it down.
We'll try.
Okay. Thank you.
I'm not convinced. You said by the end of the year. Then later on you said we will try.
No, I will not take we try. I'll take the first one.
I added we will collect, but I added that because it's also dependent on the payments that they receive as facilities. So this is the plan that we have put in place. And as and when they pay, we follow up and collect the monies and ensure that we are able to clear the debt. Thank you.
Later. Do you still supply drugs to these regions?
Yes, please.
So are these collections you're making now different from the current supplies that you are making to them? Are you segregating the supplies in terms of the current one and the arrears, such that if you tell us as at 24th, you've taken 1 million, you can say this will match to the outstanding one in the 2024 report, but not to the current one in 2025?
So we ensure that they pay the debts previously owed, not the current bills, to ensure that we are able to clear that.
So it means that the current bills or the current drugs that you are supplying is not being paid. Because if you are receiving for the old one, it means you are still piling up. And it's just the same thing.
It is a continuous process. As you receive supplies, you also distribute to the facilities to ensure that the drugs are available. So you pay and you collect.
Just let me end. So it means that by the end of the year, you will not have collected the money, because you still have had the 2025 all in arrears.
It's a continuous process. It's a continuous process. That's how the system operates.
Yes, I understand it's a continuous process. But you don't pile up debt to the tune of 36 million and tell me it's a continuous process. You have to have a cutoff point at somewhere. It can't be a continuous process. There should be a cutoff point that beyond a debt of 5 million, I may not be able to supply you. These are the checks and balances that we put in place because it's public funds. And these are monies that the hospitals also need. I mean, those who supply the drugs also need to do other equally important things and always have enough stock for the hospital. So, Minister, I think you should look into this and get them a cutoff point beyond which they cannot pay unless you clear your debt. Because you cannot, just 3 regions alone, cannot pile cost of drugs, debt of drugs to the tune of 36 million Ghana cedis. It is unacceptable. We cannot say it's a continuous process. You have to have a cutoff point. And that is how you can manage some of these things. Let's move to the Northern Regional Hospital, 1409, paragraph 1409, page 312. It's very sad that because of a project that you claim, a funding project that you received from the Japanese government, you demolished a children's ward, which was renovated in April 2021 in 2023. Couldn't we have cited this projects for improvement of health facilities elsewhere, other than breaking a renovated children's ward that had just been renovated in April 2021. Couldn't we have done that elsewhere? Has it been reconstructed?
The processes are in place.
Has it been reconstructed?
Not yet.
Not yet.
Not
okay,
yet.
so then please go ahead and answer my question. I thought it had been reconstructed, so you were gathering momentum to tell me that, Madam, it's been reconstructed.
The processes are in place to...
So if the processes are in place, why then do we demolish this one? So where do... have you created another makeshift ward for the children? What's happening?
Yes, please. A makeshift ward has been created for the children.
Why did we demolish? Maybe you would know. They have a reason. Tell us. Share with us. Because the people of in the northern region, the children's ward, they are hoping and waiting that they'll hear something positive that they demolished and.
I think the plan was in place for the construction to be done, but there were some delays in clearing the items at the port. And that caused a change in the value. So they had to revalue the whole project and to start with the construction. That was what caused the delay. But the team is following up to ensure that the construction is done.
As we speak now, you are telling us it is still in the process. They haven't done it. The people of Ghana, how do we do this to ourselves? It is not you, but why do we do this to ourselves and how? Let's check some of these things because it's all public funds. It was renovated in 2021, in April 2021, and brought down in 2023 because we received funding. We said we claim one NGO or one, is going to put up another project at the very place that we had the children's ward. I don't get it, but it's happened. Minister, I'll be very grateful if you can push through for the processes to be expedited and then construction of this children's ward starts as soon as possible. Thank you very much.
Thank you, Honorable.
Director, has the items been cleared from the port? Because you indicated that you were waiting for some tax waivers on the imported materials. What materials are these, and have they been cleared?
I don't have the details now, but it's a bilateral agreement between Ghana and the government of Japan. I will need to check to be sure of the records,
sir,
so that I don't say anything.
Sir, the gentleman sitting beside you seems to be giving you information. So it means he has more information than you. Why wouldn't you answer it, sir?
You are laughing.
Thank you, Mr. Chair. I think it's no different from what Engineer Director said. It's a bilateral agreement between government of Ghana and government of Japan, and it was like a support from the people of Japan. And the facility was instructed to go ahead and prepare the grounds. I think the facility has letters to that effect, just that the auditors were not satisfied with the evidence. Otherwise, the evidence was provided. Why was a wall be pulled down in the name of a facility that they were not very sure? No, I think they were very sure about it. Unfortunately, we don't have the control because it's a bilateral agreement between government of Ghana.
But to be honest with you, say, whether bilateral agreements or not, they never ask you to break down an existing facility to give way for clear the grounds. Couldn't you have used another piece of land somewhere? So the harm has already been done. Let's see how best we can support the minister and the team to make sure they expedite action on the processes. And once the processes are through, because it is going to be public funds, we need to go through the right processes. Once the processes are through, we can start the construction. We don't need to explain because I don't think the Japanese government asked you to break down a children's ward to give way for a project that they were going to fund. That is not the case. So let's move on. But Minister, we'll press upon you to speak to your minister and the team to expedite action on this so that the processes can go through and the actual construction and begin for the children's ward. Thank you very much.
Thank you, Honorable.
Gushegu Municipal Hospital. Is that under you? Okay. Rejected NHIA claims of 380,000 Ghana cedis. And the recommendation was the medical superintendent should use a vetting claim report to recover the total amount of the amount is at 3.8 million from the officers whose action and inaction caused the rejection and same paid into the Auditor General's recovery account. Has this been done?
Thank you, Mr. Chairman. No, please. The recommendation we had at a facility level was that management should take steps to train the officers in charge of the claims so that the quantum of rejection will come down. And so later, just a few days ago, I had this recommendation or this response from the district auditor.
Now, excuse me, please. Excuse me, please. Which recommendation? Who gave you that recommendation? The recommendation you just told me.
Yes. So it was in the management letter that was issued to the facility.
So the auditors issued that recommendation in the management letter.
Yes, please.
And isn't that different from this one over here? Auditors.
Yes, please, it's different. And even the amount you quoted, 3 million, there's some inconsistency. The amount at stake is 380,000.
Auditors, could you help us out over here, please?
380,952.
Yes, Honorable Chair, to start from where he ended, the amount actually in the report is 380,952. That is what is in the report. And then I would have to look at the management letter recommendation he's talking about because I don't have it here to really assure myself that that was exactly what was indicated in the management letter. But what we have in the Aegis report is what stands, irrespective of whatever is in the management letter.
Okay. Please turn your microphone on.
Yes, it's on, please. Yes.
Auditor, if you look at paragraph 1416, the number over there says 3.8 million.
Honorable Chair, we are looking at Gushegu. Yes. So the caption, when you look at the caption, rejected NHI claims, the amount is 380,000. And then in the condition, we give the explanation as to how we arrived at the 380,000. So the claim submitted was 3.3 million, and claims approved was 3 million, with a difference of 380,951.53 outstanding.
But paragraph 1416 says, you read paragraph 1416.
All right. Honorable Chair, I've seen it. I said, I think that there is an error over there.
Okay.
It's admitted.
So what is the status now?
So as I indicated, the recommendation in the Aegis report is what they have to implement and not what is in the management letter. Because I said earlier on, no, listen, I said that when you are giving the management letter, you have 30 days to respond. Now, if within the 30 days you are not able to respond to the issue, or you are unable to provide the remedial action as far as the issue is concerned, then the Auditor General would have to give a recommendation. So in the AG's report, you will see a recommendation that may be different from the management letter. It is because you have failed to comply with what is in the management letter. And so the AG will give another recommendation, and it is what is in the AG's report that must be complied with.
Gwishegu, that management letter that you have, what is the date on the management letter?
Mr. Chairman, the management letter date is 12 September 2024.
12 September 2024. How many years do you have to respond to the management letter?
We have responded to the management letter.
No.
Mr. Chairman.
How many days, months, or years do you have to respond to the management letter? It's in the letter.
Yes, we have 30 days.
You have 30 days.
Yes.
So if you didn't respond to it, it means it's gone.
We responded to the management letter, Mr. Chairman.
In 30 days?
Yes, within the 30 days.
What is the evidence?
So even when we saw the...
Where is the evidence?
We'll provide that to the committee.
I'm sorry?
We'll provide that to the committee.
Oh.
Mr. Chairman, we don't have it here.
You don't have it here?
Yes.
But you knew you were going to answer that one. And conveniently, you forgot the evidence. So if you don't respond within the 30 days, the Auditor General will give a recommendation, which will be different from the management letter that he's giving you. You respond within 30 days, then you are home free. Okay, Saboba District Health. Saboba District
Mr.
Health.
Chairman.
Yes, sir.
Please, can I make a remark on the substantive issue?
Go ahead.
The issue has to do with rejected claims, and the reasons that we had were system issue, because some of the over prescriptions that were highlighted, it has to do with the LIMS system that we are using. So for instance, if you give somebody an artesunate, a course of an artesunate for treatment of malaria, that is 24 tablets in it. But when you enter into the system is, considers it as 1. But the prescriber, knowing that the quantity of tablets that the patient is to take is 24. So the system, once you put 24, it bills NHIs as if you have given them 24 tablets. 24 course. That's the blisters. And so it will balloon the figure. But in actual sense, it was only 1 course that was given out. That has to do with oversupply. The other thing has to do with the multiple ANC visit. The multiple ANC visit, a patient who is pregnant by the policy of National Health Insurance Scheme is entitled to 6 visits. However, especially some high-risk pregnancies, the doctor may want to see...
6 visits throughout the 9 months of pregnancy?
Yes, please.
Just 6?
Yes, please. That's the policy. And so some high-risk pregnancies, when the patient is near delivery, the doctor may want to see the patient weekly or 2 weeks interval until patient delivers. And so all these visits, we have to submit to health insurance, but they will consider them as what? Multiple ANC visit. And so that service that you have rendered will be rejected.
How much of this rejected amount is due to pregnant women going there more than 6 times?
Yeah, so I'm taking the reasons step by step.
You see, we can't just speak in the abstract. It needs to be concrete.
Yes.
But we can all conjure so many other stories. Director General, you need to look into this and find out how many pregnant women are there and making this claim balloon like this.
Chairman, thank you. Medical soup. At times, some of these explanations, I've said, let's take our time to give. Because your first explanation you gave you out. Do you know why? You used artisanate to do your example. And you said when they enter one, because it's 24 tablet, it requires 24. Therefore, the ones that the NHIA should have accepted, the rejection should have been more than the accepted claim. Because if one tray of amodiaquine is, say, 20 cedis, and is entered into the system for 24, multiply 24 by 20. And if they accept one out of the 24, it means 23 would have been the rejected. Look at the rejected claims here. They are just about 10%, 8%, 5%. Take your time to explain. Do you understand what I mean? So if immediately you start giving this explanation, it gives away that some of these reasons and the reasons why these things happen cannot be attributed to what you are saying. And therefore, it will be purely negligence.
Director General, this will be part of your assignment that we will see in 30 days. Let's go to Saboba District Health Administration. By the way, we are still live. We are still live on TV, still live on Facebook, live on Parliament TV, and I wish some of you will see some of the comments that people leave. Is that Saboba District? Yeah. Are you from Saboba District Health Administration?
Yes, Honorable Chair.
Have you taken the oath?
No, please.
Can,
my accountant is a bit under the weather. Quran. I, Adamia Zaid,
swear by the Almighty God,
swear by the Almighty God,
that the evidence I shall give before this committee,
that the evidence I shall give before this committee,
touching the matter in issue,
shall be the truth,
the whole truth,
and
nothing but the truth. So help me God.
So help me God.
Please introduce yourself to the committee.
Thank you very much, Honorable Chair. My name is Adamia Zaid, District Health Director, Saboba.
Okay, your infraction is on paragraph 1418, unpresented general counterfoil receipts. What have you done about that so far?
Honorable Chair, the receipts have been retrieved.
And the auditors confirm, please.
Hello?
Honorable Chair, they have presented the GCRs and they have been verified. Thank you.
All right, you are discharged. Now, the next group is Nanumba South District Directorate. Are you from Nanumba South District Directorate? Have you taken the oath? Where were you when everybody else was taking the oath?
I should stand up. Yes. So please, you lift the Bible and Quran and then you repeat after me. So, I, Isaac Asamoah Abeka,
Swear by the Almighty God.
swear by the Almighty God
That the evidence I shall give before this committee.
that the evidence I shall give before this committee
Touching the matter in issue.
touching the matter in issue
Shall be the truth.
shall be the truth,
The whole truth.
the whole truth,
And nothing but the truth.
and nothing but the truth.
So help me God.
So help me God.
Okay, your infraction is on paragraph 1422. And Honorable Enim would take care.
Thank you, Chair. So this infraction has to do with unpresented payment vouchers. So the auditors noted that 14 payment vouchers amounting to 70,551 were not presented for audit. The recommendation is for the director to recover the amount of 70,000 from the accountant and same paid into the Auditor General's recoveries account. What has been done so far?
Thank you, Mr. Chairman. All such PVs were duly presented for audit. All were duly presented for audit.
All were or has been?
Yes.
So was it before or now?
No, at that time.
At that time?
Yes.
Auditors, do you have anything to say on this?
Honorable Chair, it was not at that time. It was after the report was issued. They have presented all the PVs and they have been verified.
Thank you.
Thank you very much. You are discharged. Now we are calling Western North. Also government. We haven't done it. Have you taken the oath, please? Introduce yourself.
My name is Dr. Paulina Clara Pia, the Regional Director of Health Service for Western North. Please, the name again. Dr. Paulina Clara Pia.
Yes, the rest of you introduce yourself, please. It's 5 o'clock.
Honorable Chair, my name is Ohiniba Opondako, the Municipal Director of Health for Bibiani and Yasubekwai.
Okay.
Health Services, Safia Contombra. My name is Dr. Felix Osesibe, Acting Medical Superintendent at DSO Government Hospital.
Hey, so if you also government hospital, you have an unearned salary of 3,497. What has happened to it?
Thank you very much, Honorable Chair. Please, we have recovered that amount of money and the auditors have that information.
Auditors, could you confirm, please?
Honorable Chair, confirmed.
Thank you. The next infraction is on paragraph 1013 and Juaboso Government Hospital.
That's the Jabosu, yes.
Thank you, Chair.
Juabuso Government Hospital, you have an unpaid rent of $29,260. What has happened to that amount?
Thank you, Honorable Chair. We've recovered that amount from the staff as well, and the auditors also have that information.
Auditors, could you confirm, please?
Honorable Chair, all amount have been recovered.
The next one is on paragraph 10:16. Honorable Digaf Peito.
There is this a total unearned salary of 53,615.72. However, 4,800 had been recovered, leaving the difference of 48,000. What have you done with it so far?
Please, if you can let me know which district or hospital.
Juabuso Government Hospital.
All right, please, that has also been recovered. Thank you.
Auditors, can you confirm?
Honorable Chair, confirmed.
And confirm.
Madam, Doctor, BBNE Municipal Hospital, payment of unearned salaries to the tune of 110,000 Ghana cedis.
Honorable Chair, we've been able to recover 44,471 from the staff. For the others, we have a payment plan that we are following to recover the rest of the money. Thank you.
So when are you hoping that they will clear the 60,000 left?
So please, for Abigail, she has the lunch chunk to recover, and we have a plan that makes a pay all by the end of November 2026.
2026 next year?
Yes, that is the
payment plan that
plan,
you've agreed.
yes.
Okay. We'll let it go.
All right. The next infractions on paragraph 1022, and Honorable Simon will take care of that one.
Sorry, what's the question?
Honorable, I will give you another one.
109.
It's overpayment of salaries resulting from wrongful payment. Placement.
Oh, is it?
46,908.
It's gone. Go ahead. Please go ahead.
Yes, madam.
Thank you very much, Honorable Chair. So we've been able to recover 13,000 out of the 46,000. So these staff are available and they are working. So we have a payment plan again for them to pay. The payment plan lasts 1 year. After 1 year, to be able to finish paying them the rest of the money. Thank you.
When is the 1 year due? Because we capture all these things and we will play it back to you another time.
Okay. By July 2026. Thank you.
Has a correction been done on the payroll?
Yes, please.
Auditors, could you confirm, please?
Honorable Chair, we would have to confirm that during our subsequent audit with a correction. Yeah.
All right. The next infraction is on paragraph 1026.
Some government hospital, an unearned salary of 24,000. By Fauzia Pelpo Usman Gifty, assuming Mr. Samuel Inkua and Rita Bentel.
Yes, Honorable Chair, we have been able to recover 13,591 out of the amount. Osman has paid, out of the 4,000 for Osman, he's paid 3,490, remaining 570. Rita Bentel has also paid 3,000 out of the 9,612. And Samuel has paid 2,000 out of the 8,601. Again, there's a payment plan for them to pay the rest of the money.
Usually when they are separated staff, we don't accept payment plans. That is more than 3 months, 4 months. And they separated staff. So when do you hope to finish paying this one? Please don't give us 1 year because we won't take it. They are separated staff. Because once they are separated staff, their salaries wouldn't be coming in monthly for you to make those deductions.
Madam Chair, with all due respect, I want the medical superintendent to respond to this. Thank you.
Please.
Now, the gentleman who just walked in. Hello. Have you taken an oath?
Yes. Yes, please.
Introduce yourself to the committee.
Thank you very much, Mr. Chair. My name is Dr. Ebenezer Nayanzu Ogo, the medical superintendent at the same government hospital.
So share with us, yes.
All right.
Okay, thank you very much, Mr. Chair. We had four staff that were, captured. Initially, we had issue with accepting what the auditors said. But later on further engagement, we all came to agreement that they had to refund. The reason was that they went on their annual leave based on the plan that we had for the year. Some in the first quarter, some in the second quarter. But behind the scene, we didn't know that they were not going to return. So auditors said they should refund those money because they didn't work for the rest of the year. In addition to, we had to contest the amount that were, captured because they included the tax component, which government had already taken out. So we gave them the status report, which we made available to the auditors, which will not amount to the 24,000 again. So on that note, Osman, for example, without the tax, she's supposed to pay 3,490, and she has paid that. What's that one? Gifty has refunded the total amount.
So Gifty is also cleared?
It was also cleared.
Okay.
Then we have Rita Bentel. Rita has paid initial payment of 3,000, and just last week added 1,000 cedis to it. And so she's left with Rita 4,009 up to December this year.
Good. Yes.
Samuel has paid 7,000. As for we are here to receive the payment plan, we are still contacting him. When we get it, we make it available to the auditors. Okay. Thank you.
So all this that you said, without the auditors validating even the new amount, it will not hold. So I'll ask that you work with the auditors to validate the new amount, because the new amount you are saying is less taxes. They will have to validate and see that it is correct. And then we can establish the actual amounts owing. And based on that, once the deductions are cleared, we can finally clear them. So I'll ask that you please work with the auditors to clear this out as soon as possible and revert to the committee.
Okay, thank you very much, Madam Chair. We have done same. The auditors were with us 2 weeks ago.
Oh, okay.
They left our office 2 weeks ago, our facility, and we did that reconciliation.
So audit service, please, can you
I don't know
confirm?
if it has gotten to their headquarters.
Honorable Chair, I have that information that a reconciliation has been done. The tax component has been accounted for. But the payment is where there is a variation. They are indicating 13,000, but what we have is 10,756. So we may have to do some more reconciliation to agree on that.
Thank you very much. With this, you can clearly see that they have made the effort to clear it. So work with them and make sure the right thing is done. And then please get in touch with Mr. Samuel Inkua to get you a payment plan so that hopefully by the end of the year, this matter will be closed. And the next Auditor General's report, we wouldn't find this infraction being stated in there. Thank you very much.
The next infraction is on 1029, and Honorable Elec Plum will take care of that one.
Thank you, Mr. Chair. So, unsupported payments of 350.
Hold on, madam. That one is for the DSO Government Hospital. You are still, the regional director. Okay, madam, go ahead.
Thank you. So, unsupported payment of 352,230. What do you have to say about this amount? Unsupported payments. Thank you.
Thank you very much, Honorable Chair. All right, so it is true when the auditors came, at that time, the required documentation to be attached was not there. And but now, as we speak, the attached documentation is there, and then we've shown them to the auditors. Thank you.
Can you confirm, auditors, please?
Honorable Chair, confirmed.
All right, the next infraction is on paragraph 1034. And Honorable Sebastian there.
Thank you, Chairman. This has to do with unremitted taxes. The amount involved is 5,642, and it relates to services and drugs. The recommendation from the auditors was to this effect, that the medical superintendent should ensure that the withheld tax of 5,642 cedis is paid to GRA without further delay, and any penalties arising should be personally borne by the medical superintendent and the accountant. Has this been done?
Honorable Chair, yes. The taxes have been paid, and the auditors can verify. Thank you.
Okay, but did you find out what necessitated a delay in doing what is expected of the accountant?
At that time, the accountant wasn't well. And I think that's what caused the delay. As you speak now, the accountant is still not well.
Honorable Chair, thank you.
Thank you. The next paragraph 30, and Honorable Clay to that. It's on Government Hospital.
same rejected NHIS claims, 39,597. Management, can you respond to this? What have you done about it?
Thank you very much. The Akontombra Hospital is a new one, and at that time there were gaps with the vetting of the claims. But as we're speaking now, we've been able to set up a claims vetting committee, and the claims rejection has reduced from the 30% that we see in this Auditor's General's report to less than 5% as we speak now. Thank you.
The auditors, can you confirm this?
Honorable Chair, we'll do that in our subsequent audit in terms of the committee that has been put in place and then the reduction in those rejections. We'll have to confirm that in our next audit.
Okay, the next infraction is on paragraph 1043. And Honorable Abna Oseasa will take care of that one.
I think that's the last one under the Western North. It's an unearned salary of 123,000 Ghana cedis. And it was to Miss Madam Esther Womeno Florence Jagbele Abbey, Eva Jao, Jewu Owusu, John Arthur, and Miss Rebecca Okine to the tune of 123,000 Ghana cedis, saying that we recommend that the district health director should recover the amount with interest at the prevailing Bank of Ghana rate. And these are separated staff as well, unless you have something contrary to what the auditors have written, but they are separated staff. We want to find out what has become of this, whether the monies have been retrieved and paid into government coffers as directed by the Auditor General.
Thank you, Honorable Chair. So, for Eva J. Owusu, she has paid all, and we have the receipts, and same have been submitted to the auditors. John Atta had also paid everything. Esther Wemeno has paid 2,000 out of the total of 40,000, but she has come back to duty and is currently working. So we have a payment plan with her that she's supposed to finish paying by November 2026.
Okay, so let's capture it. Madam Esther is supposed to finish paying by November 2026.
Yes.
Okay. Because
Rebecca
she has
Okine,
come back
to
the service.
She has come back to the service.
Okay.
Rebecca Okine, we established contact with her initially. On form, we were able to reach the gas, and last week she made 3,000 out of the. IOCO is currently following up on the issue, and we are also talking to the guarantors. For Florence Abbey, we've not to her, but we've reported the issue to IOCO, and they are following up on that. Thank you.
Okay, so the one with the largest amount of 63,000, you don't have any payment plan with her. She's paid just 3,000, and the matter has been referred to IOCO.
Yes, she's not willing to cooperate with us. That once we've reported the issue to IOCO, she would handle everything at the ends of IOCO. So we are collaborating with them to retrieve the amount.
Is she in the country or out of the country?
She's out of the country.
And she prefers to deal with IOCO out of the country?
Yes.
Where is she?
I'm told she's in UK.
Is she? She's a senior enrolled nurse?
Yes.
Okay. So, Minister, if your people can help us, because the nurses who validate other nurses before they are able to move out of the country, if they can help us, trace her and write to her officially, we'll be very grateful, as IOCO also pursues what is expected of it. But currently, if you can do that from your outfit, as in from the agency under you, because I know they are under you, if you can do that, we'll be very, very grateful. Because 63,000 is quite substantial. I think we are done with Western North.
Yes. We are done with Western North. You are discharged.
And Doc, please keep it up. And I hope that next time we wouldn't have most of these infractions being found in the Auditor General's book under your region. And I wish you all the best, yourself and the team. At least you've been very impressive with how you have retrieved a large amount of your payments. So keep it up. Yes.
Now, let's call Tamale Teaching Hospital. Tamale Teaching Hospital. Have you guys taken the oath yet? Hello? You are live on TV. So,
yes.
Have you taken the oath?
Yes, please.
Okay. What about the others? Okay, now and introduce yourself to the committee.
Fine. Let him come here. All right. Yes. My name is Dr. Abubakar Bawa Abdullahi, CEO of Tamale Teaching Hospital.
Abubakar Yakubu is my name, Director of Human Resources.
I am Dr. Emmanuel Senakwisi-Donko, Director of Administration.
I'm Danla Disaka, Director of Finance.
All right, your infraction is on paragraph 1425, and Honorable Kunedu will take care of that one.
Thank you very much, Chairman. Chairman, welcome. Tamale Teaching Hospital. The first infraction has to do with unearned salaries. 1,449,000 Ghana cedis. And the recommendation is that the chief executive should recover these amounts. And if you look at the individuals, you find them on Appendix K of the report. My question is, most of the times, 1 month, 2 months, normal. But when you go through the report, you have 13 months, 22 months, 16 months, 60. Over a year, you are validating people who are actually not coming to work. That is where the seriousness is. You have some of them, the type of separations that we do have. Deceased. That means the person is dead. You have resignation. The person wrote a letter saying, I'm no more working. And we never found this letter and continuously validating the person. A deceased person was validated for 26 months. 26 months. That is over 2 years. Somebody who was dead. And I wonder how that person really was working. So what have you done? Have you been able to recover some of these amounts or all of it?
Yeah, Madam Chair, we were able to recover some amount. In all, we recovered 303,558.68. That's about 21% of the amount we are talking about. Before we came here, we had gotten letters from some banks that are declining, though they have stopped the transfer to government chest. So maybe at the close of this session, we will make a prayer to this house for the house to make an order directing those banks to transfer. No, we have done, Mr. Chair.
Sir,
like
sir.
I said, we have written to the banks.
Sir,
they have paid.
Sir, let me ask you something.
Yes.
Look at Habib Napare. Reason date of separation was 2022.
Yes.
This guy had died. Didn't you go to the funeral? And you validated this dead person for 26 months. And you are coming to tell Parliament to do what?
Good. That's okay. We have taken a cue from that, Mr. Chair. Yes. So we have recovered, like I mentioned earlier, 303,558.68. We have forwarded a total list to Yoko to help us. Yoko has written back demanding for their respective files of persons involved. We have submitted that.
Director, first, have you shown evidence of these recoveries?
Sure.
The 21% to the auditors?
Yes, at the Tamale office, yes, we have done that. Maybe if they can validate that here, please.
When did you submit that to the auditors?
I think it's about 3 weeks ago. We were invited to the Ministry of Health after a meeting with the audit team. We went back and we finished the audit team in Tamale with all these pieces of evidence, please.
The number of letters that you've received, how many of these individuals does it cover? We are looking at over 70 people. Has any of them, what number, can you just tell us briefly, how many of these individuals have finished paying the amount? Because some of them you have 1 month in them. Those ones, it doesn't become an actual problem because probably the person left in a month, you probably may not see that. But those ones that increases from, say, 4 months going, that is where the issues are. So aside the letters that you've written to Yoko and their files, what exactly is the administration also doing to recover these amount? Or is it that those that are alive are not in this country anymore?
Exactly the case, my lord. Madam Chair.
Okay, so. Yeah.
Yes.
You see, it seems I just provided you with an answer.
No, there's evidence to that, please.
There's evidence to the fact that those
some of them are out of the country. Yes. Yes, please. Because the special prosecutor came into this matter. They have written to them, and they made some payments directly to special prosecutor.
They've made some payments. Is it part of the 300,000?
No. We have records of some payments to special prosecutor through us, but they made some payment directly to special prosecutor.
Do you have evidence as to how much has been made through the special prosecutor?
We wrote to them to have update on how much has been retrieved from those people. We haven't had a response yet.
How did you know they've made payments to them?
Sorry?
How did you know that payments have been made to the special prosecutor?
Oh, we called them. We had their contact, we called them, and we were in touch with special prosecutor, the officers who came around. We were in touch with them. They said some have paid. So we formally wrote to special prosecutor to give us updates on how much has been retrieved so far from those category of persons.
When was that letter written to the special prosecutor?
Uh, 21st of August, 2025.
You see, it is this year.
Yes, please.
Almost 5 clear months after the audit. And you see the problem.
Yeah.
You are very quick to stress on the fact that somebody ought to do the job that you ought to have done. Because you were verifying them. The special prosecutor had no idea. People were dead for 26 months. People had left, resigned for 18 months and the rest. And they kept validating them. You kept validating them. It means the HR cares none, head of department cares none. And we end up here telling Yoko and special prosecutor to go after those individuals when you just could have used your pen to cross their names out of a payroll. And that's the problem. So please, verify and reconcile with the special prosecutor to know how much. And don't leave the rest for anybody to do. Try and find them. You know where they are.
That's okay.
And with the banks, it is a duty that you also ought to do. Because if you tell us to give a directive, that one, we'll leave that one to chairman and the committee to decide. But I think it's not right.
That's okay.
Because you are quick so that you can leave yourself out. And we would want the committee to give a directive. That's why we were asked, did anybody attend the funeral of Habib? You did. Gave donation. Even gave his PV, Provident Fund out. And you still came back verifying him.
Thank you.
Mr. Chairman, maybe moving forward, we'll ask you to bring the validators along. So they speak to it. Maybe they saw the person's ghost or they saw the person somewhere. That's how come a deceased person will be validated for 26 good months. And then somebody who has worked for more than 3 months, 6 months, running every day to control an accountant general just to be validated. So moving forward, we'll ask that you bring validated these rules. Knowing that you validate the person for 2 years, 2 years and over. So, Mr. Chairman, I think that is what we should do. If you are cited for any payment of unearned salaries, you come with your validators. Then they will speak to it. Maybe if it's a ghost, if it's someone who is deceased, they saw the person somewhere, sitting somewhere, working, and then they can tell us the reason why they validated dead people for 26 good months. So I think it is something we should all take serious. The Auditor General, moving forward, wherever you cite an infraction of payment of unearned salaries, add to your recommendations that should they not conclude on this before it is put in your reports, they should appear with the validators at the Public Accounts Committee for hearing. Yes, thank you.
The recommendation of the auditors is we recommended that the Chief Executive Officer should recover the amount of 1.4 million with interest at the prevailing Bank of Ghana rate from the separatist staff or the next of kin of the deceased staff and pay same into the Auditor General's recoveries account at Bank of Ghana, failing which the Chief Executive Officer and validators should pay. And that's going to be my ruling. The Chief Executive Officer and the validators are going to pay this amount. It's just that simple. Auditors, take note. You see, what worries me over here, management respond. Management did not respond to the observation. They can't be bothered. Ioko, you take care of it. Parliament, you take care of it. Was I the one validating them? So that's my ruling. The next infraction is on paragraph 1429. Honorable Annex Enim would take care of that one.
Thank you, Chair. So this infraction has to do with non-redemption of bond. So the auditors noted that 5 officers who were granted steady leave with pay, vacated posts and failed to serve their bond periods as required. The officers were required to refund a total of 350,000. So the recommendation is that the Chief Executive should recover the salaries of 350,000 with interest at the Bank of Ghana prevailing rates. How much of this has been recovered, Chief Executive?
Mr. Chairman, we have almost recovered all of it. Some of the management, one of the staff was a UDS staff, and UDS and TTH, usually most UDS medical school staff are recruited from TTH. So one of them...
To make it state how much covered, the history around it.
No, I'm thinking. That's for those who want. From the UDS, whose number of months he has served was about months. The rest, we couldn't recover it. And we have also referred same to Yoko and follow the grantors to help us retrieve the monies from them. Many of these people are also not on site.
Chief Executive, I think I didn't really understand the situation with the UDS part. But can you confirm, I think we have 97,000, 42,000, 34, 89, 86. How much of this has been paid or recovered so far?
Madam Chair, this staff, like my CEO indicated earlier, one had served 23 months instead of 24. Then he transitioned to UDS and providing teaching services to our staff. Then one other person, that's Catherine, had served the 36 months, but vacated posts thereafter. So apart from that, the other persons, the other three of the unserved
so you are
still
indicating
outstanding.
from the evidence you just provided that Alasan Usmanu, who was supposed to serve 24 months,
yes,
had done 23 months.
Yes.
Then again, Sumani Hanan was supposed to do 36, which he completed all 36.
No.
How much of?
So we have not retrieved any from these persons as yet.
Okay.
But I'm saying that out of these, two of them,
okay,
more or less have served the bond.
So
that's Catherine and.
What's the evidence of them serving these bond periods?
Oh, they have been at post actually.
Okay.
For this period.
So when the auditors came,
yes,
were these people at post?
When they came back the last time, this was verified.
Okay.
This was verified.
Okay.
Yes.
So can you confirm if you verified these two people?
Yes, Honorable Chair, for the two, we can confirm that they have served the bond. The Catherine issue was the dilemma because no, Hassan, it was rather Hassan, who has served 23 months out of the 24. And is now with UDS and 7 over there. So now the issue is whether we should count that as part of the period of 7, the bond. But if that is even taken into account, what we have is that the other 3, they are yet to recover any amount from them.
So what steps have you put in place?
Madam Chair, they form part of the names we ceded to Yoko to follow up on that for us.
Chair.
Look, you see, what is worrying about Tamale Teaching Hospital? That you don't care. Yeah. When you were giving the letter, management letter, what was management's response? Management did not respond to this observation. 350,000. Look, anyway, the 1.4 million, I'm giving you 90 days to pay for it. Auditors know that. 1.4 million. The CEO and the people who did the validation will pay the 1.4 million in 90 days. How much have they collected on this one, on the non-redemption of the bond? 42,000. And let me read you the recommendation. We recommended that the Chief Executive Officer should recover the salaries of 350,000 with interest at the Bank of Ghana prevailing rate from the separatist staff and their guarantors, and pay same into the Auditor General's recovery account at Bank of Ghana, failing which the Chief Executive Officer should pay. And I will go with the auditor's recommendation. Chief Executive Officer, you are going to pay this amount also. Now let's go to the next infraction. The next infraction is unaccounted staff for 12.9 million. Honorable Duke will take care of that one.
Mr. Chairman, paragraph 1432. Unaccounted staff for 12.962120 cedis, 12,962,120 cedis. This is the findings there. The auditors noted that 129 employees with a total compensation paid of 12,962,119.56 for the period January 22 to April 24th were not at post when a head count was conducted and verification exercise to establish the existence and eligibility of the staff on the hospital's nominal roll and electronic salary payment vouchers in April 2024. So they recommended that two recommendations. The first one, we recommend that the Chief Executive Officer should immediately ensure the termination of these names on the payroll for the amount of 12,962,119.56 as unearned salaries paid to these unknown persons with interest at the prevailing Bank of Ghana rates. The second recommendation was the Chief Executive Officer should conduct an investigation to establish how these people were put on the payroll and ensure that punitive measures are taken against the officers who will be found culpable. Mr. Chairman, what is of concern is the management did not respond to this observation.
Clerk, this is a special case that we need to refer to the Auditor Attorney General for special prosecution. There need to be a forensic audit of Tamale Teaching Hospital. 12.9 million Ghana cedis, ghost names. And they didn't care. They didn't respond. Management did not respond to this observation. And you have rather gone to Yoko. Yoko will turn around and then come and investigate you. The next one is on...
Madam Chair, if we can respond to this quickly, please.
Sir.
Yes.
We shall have responded within 30 days to the auditors. You didn't respond.
It is true that we responded out of time. That is true. We responded out of
Sir,
time.
if somebody is asking you to pay 12.9 million, I don't know how much you have in your account, and I don't have that in my account as a politician, where everybody will call me corrupt. Exactly. If somebody is asking me to pay 12.9, and I know that this is not my fault, I'll respond within a day or two. But you did not respond at all. I think the Attorney General will have time to prosecute you guys. Let's go to the next.
So, no, Mr. Chair, if I can respond to this, yes.
Okay.
Yes. So
we are listening.
Yes, thank you very much. If you look at this infraction, a detailed review was done, and out of this number, it was established that 29 persons were at post, and they had gone through all the processes. They went for the head count and all that. Then official transfer letters that could not be found were made available. So if you look at that infraction, the outstanding figure, it's rather 1,646,77.23, out of which 57,110.62 were recovered. So the outstanding, as we speak right now, is 1,589,664.61. Mr. Chair.
Sir.
Sir.
This is a committee. We do not have the investigators to go into all this. So the Attorney General will be a very good person to investigate you, take you to court. And then when you go, any evidence that you have, you go and give it to the over there. The chance to respond, and you never did. So let's move.
Respectfully, I indicate this about done with the auditors. So it's not a case that we have not deferred the matter to the auditors to validate. No, please.
The Attorney General will deal with you on that one. Thank you. The next one is unapproved steady leave with pay for 3.7 million Ghana cedis.
Mr. Chair, respectfully, if I may respectfully draw this House back for a moment, if I'm permitted, please.
Yeah, I'm listening to you.
Good,
sir.
thank you. I made a submission on behalf of the facility in respect of this 12 million that is on the table. Respectfully, Mr. Chair, we have not crossed over to validate from the auditors. And I think that this was done, and we invited them, they came for the review, and this is what the records say.
Which one are you talking about?
This the third infraction, the 12 million infraction that we indicated earlier.
Auditors, the 12 million, what amount is that? Because whether it's 1 million or 12 million, you'll be dealing with the Attorney General.
Honorable Chair, so as part of the audit process, a head count was done, and persons that did not present themselves for the head count. Now, an observation was issued to them to come back to us with a response as to whether these individuals actually existed. But at the time, that information was not given. Management letter, the response did not come. The Auditor General's letter came out, and we did not receive a response. Now, the last status report that I had, as at August 8th, indicated that, yes, with the assertions
August
that
8th
of this month.
2025?
Last month, yeah, 2025.
Good.
That they came with these assertions that he is making that some of these staff some of them had actually separated, some of them had gone on transfers and all that. Well, the documents were not made available at the time. But as at the time of 8th August 2025, those assertions were also not backed with documents. But I have received information from the team that did the work. But with your leave, if you allow me to take personal interest in this matter and follow up and really furnish the committee the status of the issue, because I want to really assure myself that what I'm seeing here is what the situation actually is.
Thank you very much. Yeah, they will get the information, and it will be for the Attorney General, because they didn't respond to the auditors. Now, yes, so he is going to pursue, the Auditor General is going to pursue it. Now, unapproved steady leave with pay, 3.7 million Ghana cedis. What has happened to it?
Mr. Chair, with this infraction, steady leave were provided. I mean, they went on study leave, and the files were put together, and the documentation recovered and placed on them. So they came and had a look at them. I did.
Sir, you see, you don't pay attention to the auditors anyway. Here, let me read you paragraph 1439. Our review of the personnel records revealed that the management of the hospital allowed 14 officers to proceed on steady leave with pay in 2022 without approval. Management was unable to provide the duration of the steady leave. We further noted that these officers were not at post at the time of the head count in April 2024. That's 2 years. You were given, when they came there for the audit, I bet Tamale Teaching Hospital, they probably spent about 3 weeks over there, didn't they? And then after the 3 weeks, they had an exit interview with you, didn't they? They gave you a management letter afterwards, and you had 30 days to respond. What was management's response? Management did not respond to the observation. Now, let me read you the recommendation. We recommended that the chief executive officer should immediately ensure the termination of these names on the payroll and recover the full amount of 3.7 million Ghana cedis as unearned salaries with interest at the prevailing Bank of Ghana rate, and pay same into the Auditor General's recoveries account at Bank of Ghana, failing which the Chief Executive Officer and the validators should pay. I stand by the auditor's recommendation. You are going to pay 3.7 million Ghana cedis. The Auditor General will take care of you. Thank you very much, Tamale Teaching Hospital. You don't respond to auditors. Maybe this is the only thing that is going to shake you so that you respond. You are discharged.
Mr. Chair.
Now, Bono District Hospital, please.
Mr. Chair.
Yes, sir.
I don't know if I have the permission to.
You have the permission to,
Good.
yes.
Thank you very much. Mr. Chair, it is not the case that management teaching hospital do not just care. That is not the case, respectfully.
Did you respond to the auditors?
That is why I indicate, Mr. Chair, that we responded out of time. I must admit. We responded out of time.
Somebody asking you to pay 3.7 million Ghana cedis, and you responded out of time. Yes. You were given about 2 months during the audit, during the exit interview, management letter, and you responded out of time. Hey, Masa.
Yeah, Mr. Chair. Respectfully, Mr. Chair.
When they say corruption, it's MPs,
no.
It's politicians. Sir, you are discharged. Let's go to Bongo District, please. It's Upper East Region.
For him to temper justice with mercy, to temper justice with mercy, because it is not the case.
Tamale Teaching Hospital, you are discharged.
Thank you very much.
Now, Upper East Region, Bongo District. No. Is Bongo District ready? If not, let's move to another one. What about Presbyterian Primary Health Care, Bolgatanga? Okay, let's call Volta region. Akachi South Municipal Health Directorate. Is Akachi South here?
Honorable Chair. Honorable Chair. Please, Bongo District Hospital, they have only one issue, so we want to respond to it for them.
Are you the regional director?
No, I'm the director, internal audit.
I'm sorry, you have to wait for your regional director. You have to wait for your regional director. Volta region, Akachi South, please sit down and let's move on.
Anloga.
236.
Anloga Health. No. Anloga Health Center.
Agotime Zopoi. Zope. Angloga, it looks like you are not ready. Agotime, if you are here, can you sit down? Agotime is not here.
Is the Volta regional director here?
Is your regional director here? Okay, Volta region is not here. Ashanti region.
Honorable, I'm not dying.
Is the regional director here?
Where is he?
Unfortunately, you will have to make way for the regional director who is here. Ashanti region, do you have your regional director here? Please find your way here and let's finish with them. And then, and please, you have to move for Ashanti to take over. Once your regional director comes, we will call you.
Which group is here?
Ashanti region.
Have you guys taken the oath? You haven't. Which?
No, they haven't taken the oath. I'm wanting. They haven't taken the oath.
Is this Asokwa? Is this Adanse Asokwa? All right, please let them take the oath. And anybody from Ashanti region who hasn't taken the oath should get up and take the oath with them. No problem. No problem. Let me.
That was a live coverage of proceedings of the Public Accounts Committee of Parliament on its hearings, and you saw that the Health Ministry and 8 agencies from across the region are taking turns to answer some infractions in the AG's report that was presented to the committee. Thank you for staying with us here on Channel 1 TV. Regular programming continues right here. My name is Hawa Idrisi Mustafa. Good evening.
You're welcome to another episode of the Friends and Family Show, always live on Channel 1 TV. We're coming to you from our studios here at number 5 Ole Hansen Lane in Tesano. I'm glad that you're on the other side doing the watching and the listening. My name is Noyo Kwartey. You're very welcome to the show. Today, we're going to share an inspiring story of resilience, okay? And this is a young lady who's actually life turned to, a different thing altogether through an accident. It could have been a fatal accident, actually, and we're going to talk all about it. I just don't want to say that it sounds like a daunting experience, but I'd allow her to share the story and how she's actually moved on after all of that. You're on this show always, and we bring you great stories, and then we bring you all the things that you need to know. Real life stories, and of course, real life-changing stories as well. My name is Noyo Kwartey. Find me on Instagram at @Oyo_Kwartey. When you find me, don't forget to hit the like and the follow button. But when we start this conversation as well, you can be part of it by sending me a message via WhatsApp on the number 020-444-7033. That is 020-444-7033. Don't forget to add your name and location as well. One more time, you're welcome. Before I introduce this lady who's going to share that inspiring story of resilience, I will take a breather. When I'm back, we'll get into it. Don't go nowhere.
Hey Ghana, so you people know Miss Brother Man Small. If you knew, it's your boy. Kill them all, kill them all. But this time, I'm not only killing mosquitoes, I am killing the grades. See? This wouldn't have been possible if I didn't have the perfect mosquito-free atmosphere. Thank you, Out Insecticide. And yeah, Out Mosquito Coil. For a mosquito-free atmosphere, trust Out to... You are not serious.
Out Insecticide. So ya boa, faha.
Okay, so you're back on the Friends and Family Show, and my name is Noyo Kwartey. Before I went for the break, I was telling you about a woman who's actually going to share a story of resilience. But I'm just going to give you a brief, introduction to who we're about to have a conversation with. Now, Elizabeth Patterson was a young woman with a promising future until a near fatal car crash changed everything. Life with a traumatic brain injury, she was given little hope of survival, let alone a meaningful life. But Patterson refused to be defined by medical predictions, okay? She has demonstrated resilience and perseverance from learning to walk and speak again to reclaiming her identity and independence. So despite society's doubts, she breaks barriers, challenges stigmas, and ultimately finds purpose in empowering others. Elizabeth Ikuya Patterson is my guest tonight, and she's the founder and executive director of the Girls Education Initiative of Ghana. Okay? And their mission is to provide academic and financial support for girls, including applicants with special needs, so they may access secondary, higher education, and professional opportunities. You're welcome, Elizabeth.
Thank you so much. Thank you
nice
so
to
much.
have you.
Thank you.
You're looking nice.
Thank you.
Right.
I appreciate
so
it.
this, I've been reading it back to back, and I've actually spoken to my producer about this. I've been thinking about, it's really a very daunting experience, But I want for us to go back. Let's take us back to who you were before the accident. Okay. So your aspirations, what you had wanted to be, what you had wanted to do, and all of that.
So if we should go all the way back to when I was, you said I was a young woman. I'm still young, but a younger woman.
Yes.
If we should go all the way
before
back
the
there,
accident.
I was born in Ghana, and I had aspirations of growing up to become a journalist and doing all the things. And then when I was 10 years old, I see the pictures streaming in the background, so I got a little bit distracted. But my family took myself and my sister to the US. My mom was able to win the visa lottery. And then I started 5th grade in the US. And when I was in high school,